Aseptic non-touch technique clinical guidelines for blood culture collection. Blood culture collection generally requires a standard aseptic non-touch technique approach. This is because it's technically simple to protect and ensure a small number of key parts using a main general aseptic field, microaseptic critical field such as caps, covers and non-touch technique. Sterile gloves may be introduced if there's a risk of key site contact. There are 5 critical steps in this guideline. Preparing the procedure equipment, disinfecting the septum of the blood culture bottles, disinfecting the skin, puncturing the vein and inoculating the blood culture bottles. Preparing the procedure equipment. With apron on and clean hands, clean the tray with the alcohol wipe. Gather the equipment required, blood culture pack, sterile gauze and place them in the tray. Clean hands with alcohol gel or soap and water. Prepare each piece of equipment in turn using non-touch technique to protect all the key parts. Take care when opening the packaging of the butterfly needle, extension set and adapter cap. Do not drop the equipment onto the tray. Attach the butterfly needle lure lock to the adapter cap. Key parts should be protected as soon as possible and not left exposed. Disinfecting the septum of the blood culture bottles. Remove the plastic flip cap from the blood culture bottles. Fully open a large 2% chlorhexidine in 70% alcohol wipe. Using a non-touch technique, position your hand on one side of the wipe. Present the septum of the blood culture bottle to the top part of the wipe. Scrub the port using a few different parts of the wipe for 20 seconds. Allow the ports to fully dry before use. The present wipe is large enough to disinfect the septum of 2 blood culture bottles, the top half of the wipe for one bottle and the bottom half for the other bottle. Disinfecting the skin. Ineffective disinfecting of the skin often causes false positives and the wrong treatment is given to the patient. Cleaning the skin in concentric circles is not recommended because the circular pattern in the same direction may not allow penetration into the cracks and folds of the skin. Clean your hands and put on a pair of non-sterile gloves. Apply a single-use tourniquet and identify the vein. To disinfect skin effectively, apply 2% chlorhexidine and 70% alcohol using a suitable applicator that promotes non-touch technique. Apply back and forth, up and down strokes for 30 seconds and allow the skin to dry completely before puncturing the vein. Puncturing the vein. Remove the protective sheath and insert the butterfly needle using non-touch technique. Please note if you need to repalpate the skin after disinfecting, you will need to re-disinfect the skin again for 30 seconds. Leave it to dry before puncturing the vein. Inoculating the blood culture bottles. To prevent air in the tubing from entering the anaerobic bottle, always bleed into the aerobic bottle first. Using non-touch technique, place the adapter cap over the aerobic bottle and press down to pierce the septum. The vacuum will begin to draw the blood into the bottle. Hold the bottle upright and use the graduation lines to accurately gauge the fill volume. A minimum of 10 ml of blood per adult bottle is recommended for optimal microbial recovery and 4 ml for a paediatric bottle. Do not overfill bottles. Once the aerobic bottle has been inoculated, remove the adapter cap and repeat the procedure for the anaerobic bottle. Do not tip the culture bottle because of the potential problem of backflow of culture media into the patient. Note that it is not recommended to use the adapter cap without a butterfly needle set. If other tests are required, it's essential to collect the blood culture bottles first to prevent culture contamination. Documentation. Complete the high impact intervention sticker, blood culture collection sticker, and affix it to the medical notes. Emergency department staff should complete the blood culture collection section in the emergency department's 24-hour booklet. Thank you for watching the video on blood culture collection.